Hello, everybody, and welcome to another episode of the Healthcare Education Transformation Podcast. I'm your host, Dr. F. Scott Field, and I've got with me today a very special guest, Dr. Marie Morgan, who is going to tell us a little bit about the world of wellness. Dr. Morgan, thank you so much for joining us here today. Would you mind just starting off by telling us a little bit about your academic journey and how it's led you to where you're at today?
Sure. Thanks for having me, Scott. So my academic journey really began before PT school. I was enrolled in a program that was a psych program, and so I got my bachelor's of psychology first. And I always had PT as my first love. I was a tech when I was in high school, and so I saw that I had moved to Shreveport, Louisiana, and saw that LSU Health Shreveport had a program. That's when I applied, and I have a bachelor's in physical therapy. I went and got my master's in health sciences with specialization in education. And then my academic doctorate, my PhD, is from Texas Women's University in health studies and wellness.
I love it. I love it. That's a very straight and narrow path for someone who knew what they wanted to do very early on in their career. I was not that way. I bounced around a little, English major to PT, so that was a little different. But let's get into the meat and potatoes of today's episode. Let's talk wellness here. In your own words, like tell me a little bit about an overview or like your own definition of wellness.
Sure. So I'll tell you what it's not, because I think that's what most people kind of um, get off the path when they think this way. And this is not just me, this is the World Health Organization that says it's not just the absence of disease. And this is important for us to consider, right? Because there's a lot of chronic disease processes that are asymptomatic until they get very progressive, right? And so we can live with diabetes and heart disease and blood pressure problems like hypertension without knowing it initially. So there's a physical component to wellness, but that's just one realm, right? Which is our ability to move, our ability to eat sound nutrition, our ability to have good sleep health. But above and beyond that, it's other more holistic things like emotional wellness, our ability to regulate our emotions and be able to counteract that stress that is in our lives on a daily basis. Social wellness, our ability to be able to have sound relationships with our family members, with our loved ones, with our colleagues. Workplace wellness, or that could be school related, right? Wherever you are, what is that environment like? Financial wellness, our ability to really look at our resources over the long term. Cognitive wellness. So it really is more encompassing than just the physical component that most people think.
Yeah, I love that. Especially, it's not just the absence of wellness, right? It's not just the absence of disease, right? It's really so much more than that. There's so many layers to it, and just having health or wellness is not quite as easy as it seems on the bigger picture here. But tell me a little bit about where wellness fits into the world of physical therapy, because I know a lot of DPT schools across the nation have a wellness course in it, in their curriculum. But where does the wellness fit into the world of physical therapy?
Well, I could be biased because it's what I do for a living, but I think it fits perfectly within the realm of physical therapy, right? I mean, we've had our profession continue to evolve over the years, and there's been some key trends that have really been shaping our practice lately, and probably within the last 5 or 10 years, I would tell you, where we're going more toward preventative medicine than we ever have in the past, right? Whether that's preventing injury from occurring, preventing these chronic diseases from coming on, being able to employ health behavior strategies with our clients, which is really, really important. And also the second, I think, key trend is just that holistic health component that we just discussed. Right. So we do a lot of the physical things already with our clients, where we are looking at the range of motion and their flexibility, their strength, their cardiac endurance, their balance, which is very, very important. But then putting into practice those other things that really comprise wellness. So are we able to then provide information on mindfulness and meditation and stress reduction, or give strategies on how to change our behavior? Because that's the biggest thing, right? We're still a very sick nation, unfortunately. So we kind of know the right things to do, but why we're not doing them is a whole other gamut, right? So I think that we as physical therapists are well poised to do all these things. And that's not just my belief, right? The APTA has a stance that we are experts, right, in restoring movement, restoring function, and also counseling our clients and healthy behaviors. And as we continue to see our populations suffer from things like diabetes and cardiovascular disease and cancer, many of these things are obesity related and driven through being overweight. I think it becomes even more important for us to do risk factor screening on our clients, regardless of what their diagnosis is, right, when they first come to us. I think that's how I got started. And seeing all these risk factors that we weren't really addressing really was key to me, because I could see that those things really impacted their quality of life. So it's great that I got their range of motion back and the balance is better, but they were still kind of living this illness behavior that was going to drive them down the wrong path.
Yeah, I kind of got introduced to wellness through shout out to Mike Eisenhart and the Academy of Prevention and Health Promotion Therapies. I took his course back in the day just to kind of learn more about it because I was seeing like I kind of specialize a little more in geriatrics, and when they get to that point in life, a lot of the stories and the things that I learned through that population were regrets, right? Oh, I wish I had done this. I wish I had taken care of myself more. I wish I had gotten my finances in order. I wish I kept in touch with people, right? A lot of loneliness and social aspects of it. So it became like a bigger picture thing. And it was like, well, if we start this and focus on those things earlier in life, further up the stream, before they become an issue, before they become a regret, then it's something that I think that we can help a lot of patients with even further down the line in their life before they even get to that point. And we're very equipped, I think, to handle a lot of these aspects of wellness, as physical therapists. It kind of fits within our role, I think.
It does. And as we're seeing these challenges, these physical challenges that we're having with overweight and obesity, especially in our younger population, think about what they're going to be facing much earlier on, right? Because I, like you, do a lot of geriatric things, whether it's with the council on aging, in the community, or my food desert and physical activity desert community wellness research that I do. But I have a lot of these patients, and I always tell them it is never too late to employ them. You're never as young as you are today, right? That's what as I get older, that becomes even more important to say. Yeah, so we can actually really make a change if we can really utilize things like motivational interviewing to really change the ambivalence that we're seeing in those communities that we treat, to make those changes actually occur for them to get healthier and have better wellness.
Yeah, I mean, behavioral change is really what we're looking for, I think, in everything that we do for our patients. I think in physical therapy, we have a really good ability to help with that behavioral change because we do get a lot more touch points. We do get more time with our patients. So we might as well utilize it, right? We might as well help fill that time with useful tactics and tools they can use to employ in their life to not just rehab from an injury or get better at moving, but just to live a better, happier, healthier, more fulfilled life. So yeah, the earlier we can get them on board, the better chance we stand of making those behavioral changes. You've had a lot of pretty neat experiences within the world of wellness regarding grants, and you've had some neat grants that you've been able to work on with this. Tell us a little bit about that experience.
So, as our state funding continues to dwindle, I mean, we always get hit with either a higher education, or help, right? And both of those things get cut. And so we really have, as academicians, have to go outside of what we used to do to get grant funding. And so I've attended a couple of workshops. One was in Baton Rouge. And besides providing information on how to write more effective grants for whatever it is that you're doing, which with me was community-placed programming, they gave you resources. And so they gave you these jump drives that had in them, funders and foundations, both in the community and nationwide, that went through those philanthropic same type of efforts that you were trying to do. And so putting those two things together was crucial. I also worked with our director of advancement to get a little bit more into the meat of that, since she had that expertise, and say, okay, this is what I'm trying to do. I'm trying to work in a post-COVID world where I'm trying to get people healthy, even though we have to wear masks, and it's in an area that has a physical activity desert where people want to exercise, but it's not safe for them to do so, and they don't have access to nutritious food on a daily basis. this is what I want to do within that area. What are some, some places or some resources that I can get in order to try and get some funding? And it's been pretty fruitful. My Eat Right and Move program is now just finished phase 3, and they've all been funded both by local and national funders, foundations, in order to provide physical activity, nutrition, and actually lifestyle change that impacted the individual, the community, but policies within that community and also the environment. So we went from providing physical activity and cooking classes that was race concordant, because that was very important in research, right? It's wonderful that I'm speaking to a community that was 100% African American, but here I am not African American, and what do I really know about nutrition that would really impact them and them say, yeah, I kind of get that. And so I employed individuals that were African American to be the coaches, to be the nutritionists, and that really went a long way. So that was very fruitful. And we didn't have any nutrition, which was great. I just presented this at CSM just this past year, pardon me, in February. And then phase 2 of that program was then training the trainer. So how do we then move away, right? Because the problem with these programs in the community, the challenges that we have is that they're not sustainable. When is it that we can step away and have it move forward? So we trained individuals to be community health organizers and to take over the program. And we still had no attrition, which was wonderful. And then the last piece was, of course, now we have the people that are trained, people that are on board to do this, but then how can we change the policy, the system, and environment so it's not, a food desert anymore? So we built community garden beds and a marketplace for people just to give donations, right, in order for them to be able to acquire this food. So it's been wonderful to be funded in this way. So I would tell anyone that's looking at needing funding for programs like this to then, again, either work with an advancement person if they have one like that, or attend one of these grant workshops. It gives you really a lot of great resources as to who you can reach out to get funding.
Yeah, because it's not just about writing a good grant. You could write a great grant and still be, denied, right? So like it's connecting the dots, the right organization, the right foundation, the right person at the right place at the right time to really kind of get this across the finish line. So it's, phenomenal that you've been able to do that, and I think people don't realize that once you start a program, it's like, yeah, that's great, but is it sustainable? Can we keep it going? Because it's like a business, right? At some point, you try to remove yourself from the business and work on it, not in it, right? And so it's the same thing with any program. You can't stay there all day, every day, all the time, right? You at some point you've got to kind of remove yourself and hand it off to the next leaders to take it and run with it. So I think those are some really key aspects that people don't realize, especially when it comes to grants.
Right. And I think that's where it was so fruitful to have this connection with our director of advancement, because she actually found a foundation that was looking at keeping programs moving forward after COVID. That was exactly what I was trying to do. That was insane. It was such a good fit. I mean, so when you can find these foundations that have the same, again, efforts moving forward, that they would want to fund that, it makes all the difference in the world, because we've all put grants, out and nothing has come from them. And so, yeah, it was very, very important to make those connections that we're seeing.
Yeah. Well, as we talk here, like I said, it seems like PTs are really primed to make some impact in the world of wellness here. What opportunities do you see coming down the line in the future for physical therapists in the world of wellness? Where do you see the opportunities kind of opening up for physical therapists?
I think that the opportunities are going to continue to grow. Let's start there. But I will tell you, there's some cautionary things, and there are also some challenges that we have to address, right? So number one, depending on where you live, right, we all have different scopes of practice depending on the state. They may vary a little bit. Okay, so the example I'll give you, and I tell this to my students here in Louisiana, is nutritional counseling. We, as physical therapists, can give sound nutritional guidance based on USDA guidelines. And the new guidelines just came out for 2025, right? That we can give our patients. So anything they can basically look up, we can certainly counsel them that way. However, if our patients have more complex needs, let's say they have IBS or cancer or an absorption problem, then we would have to refer to a dietitian or nutritionist, right? Unless we have some type of training, whether it's licensure or certification that proves otherwise. So for me, with my PhD, I'm able to do those things because that was part of my training. But I tell my students that leave our program with a clinical doctorate, a DPT, that they would have to kind of be careful along those lines. That being said, right, there is a host of institutions, including our organization, APTA, like you just said, we have a health promotion and wellness network that they can tap into. The American College of Lifestyle Medicine is a great institution that people can go to for education. The American Public Health Association have also presented some research there, and they have some great resources there as well. And so these and many other institutions also offer things like health coaching certificates, and a lot of PTs are going that route. Because when we asked, or not we, but APTA had asked, why aren't you doing these things to move forward with wellness? Many of them said, yeah, I'm not really sure, I really know, or I don't really feel comfortable asking about stress reduction or maybe sleep hygiene. And so, or even health change models, right? Health behavior change. And so these certificates are giving PTs a little bit more ammunition and their training in order to be able to provide better advice and better counsel to their clients. So I think that if you're wanting to start, these are some places that you can get some really good resources from and education from. I
Yeah,
would tell you, go ahead, go ahead.
let's dive into that a little further there because let's say I'm a new grad or I'm a PT. I'm hearing you say that there's a couple of different aspects here that tie into wellness very nicely. It sounds like social determinants of health are pretty big. Maybe population health a little bit that overlaps in there a little, and we can use wellness as kind of the conduit to like get in there. So if I am a new grad, if I'm interested in treating populations or doing more with social determinants of health and introducing wellness, where do I start? How do I get started? What path should I take?
Right. And that's what I tell students as well, that they have to see what they're seeing in the populations that they treat or the populations that they want to treat. Right. And so you have a lot of PTs currently that have gone the concierge route if that's what they wanted to do. And this is part of the challenge that I was going to touch on, right? Because of reimbursement models, sometimes we have not been reimbursed well for wellness, although there are some things that are really have gotten better, like say the annual exam that now Medicare covers, right? And so there's been a challenge there, but I think as we keep moving forward with value-based models, that we're going to have many more opportunities to provide preventative practice and these wellness initiatives with our clients where we're better reimbursed. I mean, when you look at the return on investment, it's phenomenal, right? Any employer who has utilized physical therapists to employ these things or any other kind of health professional to employ these things have gotten a great return on their investment. So it's a very sound investment for people to make. So I think that once we always see, once Medicare comes along, then third-party payers go along, and then we'll get these things reimbursed. So I think that that's one of the challenges that we have seen. But I think the other, and it's up to us for the second challenge as well to try and move past this, is that a lot of our communities that we treat know us as these experts when they have decreasing function, when they have pain, not knowing that they can come to us to improve their quality of life in other ways. And so there's this disconnect sometimes, right? So I tell my students, you can put a proposal and go to a physician's office or go and during PT month and do a podcast. I mean, that's why I love this because you can get the word out there, not just to PTs, but also to our communities that this is what we do. We can make you better. We can make all these areas of your life better. And although you may come in initially with knee pain, right? I can address a lot of other things that maybe you weren't taken care of. And I think that's how my transition, that was very organic in nature, that's what occurred. I started treating these patients, many people of color and other things that had these social determinants of health that were holding them back from other things. So, I mean, how inaccurate would be my assessment to give a patient a home exercise program for them to do walking in their neighborhood when they can't walk in their neighborhood. And so that would make them non-compliant. And if they can't afford to go to a gym or not close to a mall where they can go walk, then when I ask them, have you been doing the 10,000 steps a day? They'll say, well, no, and not really understanding why. So we have to understand the impairments that our communities have. We have to understand what are their challenges, and some of them are structural in nature, right? Some of them are perceived in nature. That's where these behavior change models come in, right? Because either way, the outcome will be the same. If they can't really do it, or if they think they can't do it, right? Maybe they weren't efficacious in doing it in the past. And like, no, I've tried dieting, and I hate that word, right? It's a four-letter word. I said, no, this is not the way we're going to look at it. All right, we're going to look at it from a different perspective. So we got to get our patients past those challenges in order for them to become well. So I think that we as physical therapists really need to assess what those needs are, what those challenges are, and how to move past those to have to give our patients better health and better quality of life.
Yeah, it sounds like the starting point really is advocacy, right? Advocacy for yourself, advocacy for your profession, advocacy for your patients, and then advocacy for the population that you treat, right? So meeting them where they're at, right? Being part of the community. There was an example of this, and I'll probably butcher some of the details, but it was a like a granola bar company, right? And a physical therapist went in and kind of pitched a proposal that, hey, listen, you guys are really into wellness and health, right? And you give all of your employees an hour off each day to go work out at the company gym. Why don't we bring in a physical therapist and an athletic trainer, right? And we'll get everybody through their workouts and stuff. Then, if they're having any health issues or anything like that, they can come in and we can do, our PT evaluation, see how that goes. And if there's something that we have to refer out to, we can, but if we can handle it here in house, we'll do that as well. So if that same model just gets applied to a community, right? It's like, okay, instead of a group of employees who are, looking to get healthier and live a happier, healthier workplace lifestyle, it translates into a happier, healthier home lifestyle, right? If we could just employ that in a community based on the population that is there, that's a pretty good step to just transfer our knowledge that we already have as physical therapists into this wellness model, and reaching, more people. And again, like you said, the payment models are bumpy, right? They're hard to navigate a little bit, but I guarantee that physical therapist at the granola bar company is getting paid a pretty good salary to do that, right? So if we can just find the right ways to monetize it in the community aspect, whether it be, saving money or, helping become more of a blue space, right? Or a healthier zone, right? That's going to help a lot more people in the bigger picture instead of just like that one-to-one patient treatment stuff, right? Which is fine. There's nothing wrong with that. We need that too. But also, if we have that overview of like, hey, wellness is going to be our thing. And then if something also comes up, you can come see me for physical therapy. We can get that addressed too. But we're also going to be employing a lot of these wellness tactics within your physical therapy too, right? We're not just limited to that 9 to 5 one-on-one patient care model anymore. It's a part of it, but there's a bigger picture that we're supporting as well. So I think that
So
becomes big.
hopefully it's a pebble in the pond,
Yeah.
right? And the more organizations that I have worked with, whether it was just going to do, a volunteer type of lecture on anything, on sleep health, on whatever that is, or I've actually had some people that do some concierge work and other work in the community, one-on-one with patients, and they have told me the word of mouth, just that, because patients aren't getting that holistic viewpoint from anywhere else, especially in your smaller cities. Okay, we're not in LA where that may happen more, or San Francisco, or New York, but in the smaller cities it hasn't been happening. And he gave a great example on how small things can make a big difference. So he told me that he was going to go do an initial evaluation on a client that was having some problems. He was going to address all components of wellness. And right before that initial eval, he got a call saying, can't believe I'm going to have to cancel because I just came down. I have a sore throat and a little bit of a low-grade temp. I got a little viral stuff happening. So can we reschedule? So he said, of course, of course. I'll call you in a couple of days and see what would be good for you, depending on how you're feeling. So instead of going back home, he stopped by a pharmacy and in a little basket together, some nasal wipes, a decongestant thing. I mean, something that cost less than $15. Left the basket at your doorstep and then called and said, hey, go to your front door. I left something for you. I hope that this helps. The amount of referrals that he got just for doing something small, because she went back and told the physician, this guy's unbelievable. It's the little things that we can do, right, that can provide some emotional wellness to let the patient know, wow, they're really listening. And so many times, as because of the amount of patients that we have to see, and physicians the same thing, you don't have that type of care. And I think that can go a long way also. So whether you're doing something community-based like I do, trying to address the population at large, or doing one-on-one and starting that way, little things like that can make a huge difference.
Yeah, I mean, it's amazing how much impact we can have and how much we can grow by those little things, right? And just showing people how much we care. Because again, at the end of the day, like we just want our patients to get better. We want the best possible outcomes for as many possible patients as we can. And if word of mouth is the way to grow that, then that's fine. We'll do that, right? But if that keeps growing and eventually we outgrow those britches and we need to, address a population, well then yeah, maybe we start adding in quarterly talks on sleep health and hygiene and stress management and those other things. These are all great ways to advocate again, not only for yourself, but for your patients and for the profession, and it's nice to see people doing things like that because at the end of the day, I think that's what's really going to matter to our patients, so I think that's where we need to keep our eyes, not just in the direct, immediate, I have 8 patients tomorrow. These are who I have to treat, but like, how can I make a bigger impact? How can I, grow my wings a little bit and spread my wings a little?
It's a win-win, right? Because they get to know us a little bit better as what we can offer. But I mean, how I got started with Eat Right and Move is we were just doing some health screenings and doing a little bit of motivational interviewing, but getting some baseline data. And that's when we saw the need and we said, okay, well, are you concerned about this part of your health? And if we offered something here, would you want to participate? And they said yes. So the initial pilot, because we wanted to see what we would get from that, right? And so we knew that if we ate right and moved, we would get better, but we still had to prove it. So that pilot showed us, yes, it works, because we looked at A1C and we looked at vitamin levels. I even did microgreens within the diet. There are a lot of things that we looked at. We looked at uh, cholesterol levels, triglycerides, a lot of different things, as far as cardiovascular health and strength and balance. And so we got those numbers, which were great, right? So then moving that into that training component and then into changing the environment, we had to get all that data as well. And now that we have all that back, we just applied for a grant to move this to a completely different area of the city that has some of the same food and physical activity deserts. So once we had the pilot done, we're like, nope, we can prove that it works. So now let's move it to another area. So now it's going to be a little bit easier, right? But at first you have to prove these things. It's got to be data driven, but it allowed that community to get to know us better, right? And it allowed us to get to know them better and what their needs were. And I think that that's, again, just a win-win.
And because, like I said, we have the ability to see these patients more frequently and to have more touch points and longer time with them to get to know them, right? We should utilize that as a benefit, right? And I think it's important, to realize that like once that data is collected and then it can grow and scale and keeps growing and scaling to other areas, right? Like you said, it becomes plug and play. It becomes a little bit easier because it's just, hey, this works. Here's the same program. Now we implement. Hey, this worked again. Here's the same stuff. And now we implement. And you just keep growing from there. And I think, people get hung up a lot of times on like the reimbursement or the payment side of things. And it's like sometimes it's hard to show companies that what we did or what we implemented prevented something further down the line. Like, well, they didn't get diabetes or they didn't become obese or whatever. And it's like, well, yeah, because we implemented the program to stop that. And you're trying to show something that didn't really happen. But if the health markers are all going up and they're all getting good results, like eventually you have to put two and two together that that's going to happen, right? We're going to get better outcomes. We're not going to get diabetes. We're not going to be obese. We're not going to have, blood pressure issues. So at some point, the companies are going to have to start saying like, yeah, I guess you do know what you're talking about, and you are preventing this, which is going to save them a ton of money in the long run, right? Not having to pay for chronic stuff.
And so it's going to decrease people from being absent from work. It also increases productivity. We also did a quality of life measure on these people that were involved in Eat Right and Move. And we looked at mental health as well, because that's a big component. And so you saw how their quality of life changed as far as emotional health along the way. Because if you have pain, you're really probably not going to do as well at work, or you're not going to be able to focus as well. And so there's all these things that come into play, or even with nutrition, all right? If they are living with food insecurity, you're also going to have problems there. I mean, so we were able to that's why we wanted to kind of look at all those aspects of wellness and see how those could play. So if you're working with a company, you can certainly show these things that, research shows you that if you have sound emotional health and that you eat well and move more, that you're going to be more productive at work. You're not going to be as absent. You're not going to need all the days off, the sick days, the doctor's visits. And so, yeah, I think that we have shown that in research, and that good sound return on investment is what people really go for, that employ these employees. So I think that that's a niche that we really haven't gone toward with that. We really need to move into that area because we can't provide those things. And again, the research is out there showing that it makes a huge impact.
Yeah, I mean, I'll take a happier, healthier workforce over the zombie workforce all day, every day, right? They're just going to be more productive, you know. Plus, I don't know if you've looked at this or not, but it probably leads to better retention too, right? If people are happier and healthier, and your company is providing or supporting that, my guess is they're going to want to stay there. You know, they're going to want to continue to work there.
Because we use it for recruitment as well. I mean, that's even at the academic level, right? We now have institutional wellness for everyone on campus. And so that's a huge recruitment tool because we offer a supportive environment that we care about you, right? And because we care about you, we have a food pantry. Because we care about you, we have a teaching kitchen to show you how to do these things. Because we care, we have meditation rooms where you can just unplug. We have a physical activity fitness zone where you can, get rid of some stress. And so these things are also great ways to recruit employees and students as well.
Yeah, for sure. Well, Marie, I can't thank you enough for taking your time and coming on here to talk to us about all things wellness. We ask all of our guests this one final question, and that question is, if you could change one aspect of higher education, whether it be DPT or otherwise, what aspect would you change and how would you change it?
That's a great question.
Yeah, it's a big one.
Well, I think the challenges that we face in higher ed, I have to say are many times related to, again, the funding that we have, right? And so I know that for me working in Shreveport, all right, which is a smaller town, recruitment of both students, residents, or faculty is a little bit tougher because we don't offer all the things that bigger cities do, right? And so funding comes into play, and also the way we look at recruiting individuals. So with higher ed right now, we would like to go toward a model where we can do a lot more virtual things and have people be able to chime in like you're doing right now, in order to provide a more diverse, workforce as well. So I think that's one of the things that we're looking at is trying to utilize some of these strategies to continue to have the best of the best, although sometimes that's a challenge, again, depending on where we are. That's just one of the things that we look at. And I guess it's only because the budget season is coming up and that's in my brain right now. But that's huge. And that's the reason why we try and do what we do at the level we're doing with food pantries, because of the problems with funding, because of the problems with inflation, because of all the things that we're seeing, because of tuition continually going up and being a state funded educational program. We can't make money by continue to increase tuition because we're not going to have students, right? And we can't just keep growing the program because there's also structural things in place that don't allow us to do that. So I think ability to look at things a little bit differently and funding a little bit differently in order for us to continue to move forward with education in the best possible way to put out the best PTs to then serve our communities. And so that's not my wheelhouse. I go to experts for that, and that's what I continually do, saying, how is it that we can move forward with the challenges that we're currently facing? And we just had another 3% cut, and that's what we're looking at. Some creative ways to be able to offer what we offer, and do so in the best way possible.
Yeah, I love that. More efficient, and still delivering the top tier knowledge and transfer of knowledge that you possibly can, given the tools you work with. So I love the fact that, you're kind of thinking of a creative approach to deal with the budget cuts. And, they're probably inevitable, to be honest with you. I mean, at some point there's got to be a ceiling to tuition, right? It can't just keep going up. We say that, and yet it does. But at some point, you're going to price yourself out of the market, right? Like people just aren't going to keep paying, more and more and more for tuition. At some point, it has to have a ceiling. So, what are your approaches, right? How are you going to react to that? How are you going to adapt to still be able to deliver the curriculum and content you need to on a more efficient way? To really help save some of those budgetary needs because we're all going to deal with them. That's for sure.
Be good stewards. That's what we're trying to do.
Yeah, I love that. Well, Dr. Morgan, thank you again so much for your time and for coming on. Where can people reach out to you or follow up if they have more questions or just want to see what you're up to these days?
Sure. So they can reach out at Marie.Vasquez, Vazquez at lsuhs.edu. So you can just Google Marie Vasquez Morgan and my webpage will come up. We have an institutional wellness webpage that's outward facing as well. And so anyone that reaches out to me, I'm more than happy to answer any questions. And really, I love to get with other people in other areas of the United States to see what they're doing. And certainly for collaboration purposes as well. So please reach out to me. You can just look me up on Google or get me at that email address.
And we'll put those links in the show notes so you're easy to find. Dr. Morgan, thank you so much. Been an absolute pleasure.
Thank you so much. Appreciate you.